Good afternoon, and thank you all for taking part in First Read Coronavirus Update, the first in a 4-part webinar series with some of the biggest names shaping New York's response to the pandemic. I'm Zach Williams, staff reporter at City and State Magazine. Today's discussion is going to be focused on health topics related to the pandemic, especially ongoing efforts to control the spread of the coronavirus through contact tracing and quarantine, as well as everything having to do with the new vaccine distribution process. But before I introduce our panels for today's discussion, I want to thank our great sponsors, Farrell Fritz and Somos Community Care, for helping us organize this event. I'll do a little bit of clapping in honor of them in lieu of audience applause. Okay, so let's jump right into it. This is who we got for today's event. Please just raise your hand, give a little wave as I give your name and title. We got Dr. J. Varma, Senior Public Health Advisor to Mayor Bill de Blasio. Kapil Longani, Counsel to the Mayor. Bess, Chiu, Chief of Staff to the Counsel to the Mayor of New York City. Mark Ustin, New York State Regulatory and Government Relations Partner at Farrell Fritz. And Dr. Ramon Tallaj, Board Chairman and Founder at Somos Community Care. We got all of you are bringing quite a bit of expertise to our discussion. So before we jump into the immediate topics at hand, I was hoping you could each just say a few sentences about how you fit into the overall response to the pandemic. Maybe we're starting with you, Dr. Varma.
Great, thank you very much, Zach, and to everybody else for including us here today. Sure, my name is Jay Varma, and I currently serve as a senior advisor to the mayor. My primary responsibility has been since April of this past year to help the mayor and the city agencies guide the response to the COVID pandemic. So that includes everything from working on the phased reopening of our businesses, the safe opening of our public school systems, and all the strategies that we've used to control the epidemic, including testing and contact tracing.
And we'll keep doctor's preference going. Dr. Tallaj, could you say a little bit about how you've been working during the pandemic?
Well, our voluntary responsibility has been from the beginning to be sure that people with low income resources, our community that we serve, close to 1 million patients, plus any other person, including those without any documents or needs, get first at the beginning the testing in all boroughs, starting March 15, Stock Exchange, and then going to Queens and everywhere, and then Bronx, Manhattan. Then feeding the people, and then now doing the vaccine. I believe the most important is our mission to take care of the poor. At the same time, we take care of the poor, care for the people with the health care that they need, and treat the other ones the way that we would like to be treated ourselves.
And Kapil?
Hi, Zach. Hi, everybody. Thanks to City and State and all our sponsors. Really appreciate it. We have a great panel. Let me tell you a little bit about what we do. I am the counsel to the mayor. And in that role, every sensitive legal issue that gets to the mayor goes by my desk first. In many ways, the best analogy is to the White House counsel's office. I think a lot of our audience is familiar with the White House counsel's office and their role relative to the President of the United States. That's the same function that we serve vis-a-vis Mayor de Blasio. So, issues like how do you make outdoor dining legal? How do you open and close schools legally? Do you need to do them through executive orders? Do you need state law? How do we negotiate protections to ensure in the context of contact tracing that our fellow New Yorkers' privacy rights are protected? Those are the types of things that are deeply sensitive and important to the mayor, and our office has a central role in all of those issues.
And Bess?
Hi, thanks for having us here. So as you mentioned, I'm Chief of Staff to Kapil. And so, I work with him on the day-to-day management of our team and answering the legal questions. Kapil touched on some of the things that I think we'll be discussing a little bit later today. But I do want to note that, I've been here since 2014 and the role of our team has really changed during the pandemic. We have taken, I think, as Kapil mentioned, we really do play a central role providing legal guidance to the mayor, but also during the pandemic, as you all may have seen, the governor and the mayor has issued a lot of executive orders. And I just want to flag that our team actually drafts all those executive orders that get issued or renewed every 5 days. And so we've really taken a central role there. And we've been really working very closely with our sister agencies, with our public health experts like Dr. Varma, with the Department of Health, the city's emergency management team, and also taking more of a public-facing role, which is, I think, new for a general counsel's office and perhaps a bit unique, to provide members of the public with information on rules and regulations through both our Twitter account and our website.
And Mark, last but certainly not least, tell us a little bit about your work.
Sure. I help my clients, whether they be providers or others outside of government, understand what people like Jay, Kapil, and Bess are doing. As Bess mentioned, there has been an awful lot of law created in the last 10 months on the fly. Largely things that normally would take years to be finalized have had to be done in days. And I and healthcare lawyers like myself have spent a lot of time helping our clients understand exactly what those things mean. And also, as those things are applied, relaying the results of that work back to the decision makers who in turn then adjust as necessary.
Awesome. I bet our audience has all sorts of questions for so many learned panelists. But before we get to that, we're going to leave some time towards the end of the panel discussion for that. But I want to, first take the chance to ask a few questions of the panel to see where we're at in the pandemic response exactly, and how all these different moving parts, we hear so much about contact tracing, quarantine, testing, vaccine distribution. It's hard to imagine that really none of this existed 10, 11 months ago. Maybe I'm going to turn to our friends in city government first to just give us an idea of where things stand right now. Maybe Dr. Varma, you could give us a sense of, just the sheer scale of all these efforts: contact tracing, vaccine distribution, quarantining. Where are we at right now?
Yeah, great. No, thanks for the question. So I think it's helpful for people to let me just try to frame for people to understand sort of how it is that we fight off this infection, because that gets to what are the things we had to create and what are the things that we're going to need to keep in the future, and what can we take away. So really, I like to think of it as we before we had a vaccine available, we really only had 3 tools to prevent people from getting infected and dying from this infection. We have things that individuals can do themselves. You can wear a mask, you can wash your hands, you can maintain distance, things that individual people on their own behavior can do without government needing to be involved necessarily in any meaningful way. The second are things that individuals do, but they do them somehow in partnership with city services or with private services. And that's trying to get tested frequently, because we know you can have this infection even if you don't have symptoms. If you test positive, then staying separated for a safe period of time, or if you're a contact of somebody, also staying separated until you're no longer at risk. So that's what we sort of umbrella term called contact tracing. And the third is of course, things that government has to do to restrict activity. And those are the things that I think a lot of us are going to be talking about today, the regulatory measures where you say, look, individual behavior isn't enough, contact tracing is enough. We have to just simply close certain or restrict access to certain high-risk settings. And now we have a fourth, intervention that's now available, which is really the most important one, which is a vaccine. And a vaccine is so important because it requires other than getting the initial dose or the second dose, if it's a 2-dose vaccine, it requires no further behavior change on the role of a person, and it requires no further actions by government at all. So what's had to be created here is basically, since last spring, are creating huge supplies of mask distribution, so that we can get masks to people, whether you're getting them on the subway, whether you're getting them in a school setting or anything else. So that it required the establishment of a massive supply chain, getting supplies also to hospitals as well, and of course, all the cleaning that has occurred and the hand sanitation. For contact tracing, it required the hiring of thousands of personnel. I think we have over 4,000 people employed by our city contact tracing program. And then of course, close partnerships with Somos and a number of other providers to expand testing. We now do about 100,000 tests a day, which is sort of an audacious goal that we set out back in April and May, and now we are at. And then of course, you have all the legal issues related to restrictions on business activity that I think we'll probably end up talking about. And of course, now we're in a vaccine distribution program, which is really the single biggest problem with that program, is just an uncertainty about supply. And one of the reasons people have complained about the fits and starts that we had is because we just haven't had enough supply. But I mean, I think the really remarkable thing for people to understand is as of today, we vaccinated 500,000 New Yorkers, which is a really remarkable feat. And we're really on target to really hit, very high immunity levels over the next few months if we can maintain access to the vaccine. So I'll stop there because I touched on a lot of things. I wanted to try to answer your question about what is the sort of magnitude of all the things we've done and where might we be headed.
Yeah, and I'm glad you highlighted all the different layers to public health responses. I think something I learned in recent months was about the Swiss cheese model, right? You have public health restrictions, you have personal responsibility, you have vaccines. So much has been done in the city to ramp up testing and begin the distribution process of the vaccine. So it sounds like all you got to do is get a bunch of smart public health experts like Dr. Varma or Dr. Tallaj together, and some emergency powers for the mayor, right? And you just say it and it's done, right? Or is it a little bit more complicated? I recall we got a federal government, a state government. Maybe someone from the council's office can tell us a little bit about the legal landscape that the city has to work within to implement its response to the pandemic. Who wants to handle that one?
Sure. So I'll start and Kapil will jump in. I think, one of the great things that, or from my point of view, is that, during this pandemic, from a legal point of view, we've really been relying on our doctors and our amazing public health experts, both within at the city level, like Dr. Varma, and also at the state level. And so really everything we've been doing with the executive orders, with the regulations, has been done based on the guidance from our public health experts. So we talk pretty frequently. I think Kapil can probably shed a little bit more light on this. I know that he and Dr. Varma talk often. And they're the ones telling us, we need to restrict the movement of people, whether it be through quarantine orders, traveler checkpoints, through having to close down certain non-essential businesses so that people are isolating. We've done a lot of work in that area. I mean, some of the legal questions have been, what is the authority to basically tell people that they need to stay at home? What do we have to do to stand up a contact tracing program, which is extremely robust, and how do we protect people's personal identifiable information, and how do we encourage people to share their information with the contact tracers and answer their calls to make sure that on the public health side and on the operational side that these things are done in a way that can benefit the members of the public. One of the things, I think a couple of examples, at least on the contact tracing side, as to kind of how our team has been involved, is we've worked really closely with Dr. Ted Long, who is the head who oversees the test and trace program for the city. We've reviewed, their outreach scripts. We've worked on their vendor contracts, on the agreements, between the agencies with data sharing, and the Mayor's Office of Information Privacy and the city's Chief Privacy Officer, for example, reports to Kapil. And we've been working very closely with them to ensure that the appropriate agreements are in place to protect people's privacy.
Yeah, and I would just add one thing here, and that is these restrictions are not random. I think we live in New York City. Dr. Varma, I can say, and I can speak on behalf of the mayor here, they understand the onerous nature of these restrictions. And every restriction that is put out, whether it's through executive order, whether it's through the mayor's executive order or through the state's executive orders, are really thought through at the highest levels. And, I think Dr. Varma and I often talk about restrictions making sense, right? It's got to make sense from a public health standpoint first. If you're going to restrict, an office building to 50% capacity, or you are going to allow the exchange of people's medical information between agencies, that has to make sense from a public health standpoint first, before it even gets to the lawyers, right? And I think that's how courts are not exempt from this new world that we're all living in, Zach. Post-pandemic, the courts have also had to adjust to this new world. Most of the judges have never gone through a pandemic. And so when people challenge state restrictions or city restrictions on movement or capacity, for example, courts have really had to struggle and come up with, well, how are we going to analyze these restrictions and the constitutional rights involved? The Constitution doesn't go away just because we're in the middle of a pandemic. And Dr. Varma understands that, the mayor understands that. And, you know, I will tell you the vast majority of our conversations with the state, at least the ones I'm involved with, are about these weighty constitutional issues. And everybody is cognizant of how important it is to respect people's rights. And if we are going to put restrictions in place, it has to be because it is for the greater good of our fellow New Yorkers. And that is the sort of teeter-totter that we are on constantly. And I think, as Dr. Varma will say, you know, as we learn more about this virus, sometimes that calculus changes. And courts understand that. This is not something, our state of knowledge is not frozen. What we know now is very different than what we knew back in March. And that's why, you know, one of the things we were involved with heavily was the creation of outdoor dining. You know, it's a unique program here in New York City that has been wildly successful. And Dr. Varma was a huge part of that because his view, and I'll let Dr. Varma talk about his scientific view, but in layman's terms, outdoor dining is much safer than indoor dining. And so we then got to work on, you know, with the Department of Transportation, the Department of Citywide Administrative Services, Department of, I mean, you name it, they were probably Department of Buildings, probably 15 agencies we had to come together with to create this program. It's great. If anybody, you know, that lives in New York City knows, it's been really, really popular, but it was incredibly complex from a legal perspective to get it off the ground. But I think it's been of a great success for all of us.
Mark, could you tell me a little bit about how people outside of government are keeping up with this rapidly evolving regulatory environment?
Sure. I mean, you just heard the real experts talk about the various structures within which they work and the various competing policy priorities. I mean, even just at the city level alone, there are so many different entities and individuals involved in the decision making, and that's a good thing. But, you know, imagine from an outsider's point of view, not knowing who's making the decision when, and that's even just at the city level. They've also then got to work with individuals at the state level. And then, you know, the federal government has a role here too. So from an outsider's point of view, you know, it's all about, it's fundamentally, I think, the same problem that everyone has during the pandemic. It's the uncertainty of it and the lack of predictability of it. So, you know, and you know, they're working, you know, they're basing their decisions, as Kapil said, fundamentally on science, right? It's, you know, they're not making a decision unless there is a compelling public health reason for it. But then there's lots of other things going on too. And, you know, the question from an outsider's point of view is, okay, how does that affect me? And then, you know, how do I make sure that, you know, my perspective is taken into account? Not that they're not, they certainly want to, and they are to the extent that they can, but as things move very quickly, you know, very often you have the situation where you have to have an iterative process where, you know, things start moving in one direction and then they change over time as we learn more.
Now, I would imagine Somos Community Care, for example, deals with a lot of, you know, ordinary New Yorkers who don't necessarily have access to public health experts on a daily basis. You know, things are always changing. We hear, you know, back early in the pandemic, we heard don't wear a mask, and later on a lot of effort was spent convincing people to wear masks. And now we're seeing a similar effort with vaccine distribution, making sure that people have confidence in it. Dr. Tallaj, maybe you could tell me a little bit about how you've seen, you know, the people that your organization serve kind of react to these ever-changing public health guidelines.
Also kind of difficult to understand because a pandemic never happened in our lifetime. Nobody's alive in the world right now, live one. But what I hear all these experts talking about all the issues, legal issues. I guess the learning for the future, before I talk about you ask me, is get ready to have that for the future. We don't have to start in zero again. It's happened with some of the virus. All these legal should be already set up to the point that now with this communication kind that we have with internet and those facilities to see each other around the world, we should have all these documents ready to act in any. What will happen to us is different. What happened to us is we have no time to waste. I know sometime, and this is why I said it's the pandemic nobody knew. I see the way that the city of New York has stepped to the plate now and is doing so fast, and we are doing vaccination. At the beginning, it was slow because nobody knew. But we, as a doctor, trying to understand track and tracing from the beginning, that's why we move so fast. We got 70% positivity in Queens and the Bronx, and it was kind of difficult for us because we see our people in the houses. We were calling through telemedicine. How hard was the situation? Then we, from the beginning, used masks. We didn't start the mask use. As a matter of fact, we created a webinar was used around 14 states around the country where we tell the people, I don't care what Mr. Foss is saying. It's a need to use the mask and the wash of the hand. We established kind of protocols when you get out of the house, come back home, how to do that. But one important is about all of these things is that it doesn't matter where the patient is, it's the same thing. We weren't prepared. Right now, let me tell you that what the position right now. We are testing, as they said, massively, which is very important. At some point, people were saying, you don't need to test. There was a kind of, oh my God, what are they saying? And it was difficult to find reagents for the computers who do the test. It was difficult to find the PPE. Me and my wife is an epidemiology in Dominican Republic. We were looking for that while before that. We have a first meeting in March 5th to try to establish what we need to do, 1833, Somos NY number, to start telling the people what to do. We put telemedicine in all our practices. By March 5th, we got the capability to all of them. For example, right now, when I heard about the lack of vaccine, it's not true. I would like to have 1 million vaccine tomorrow, and they disappear tomorrow because they work to the arms. We do not storage vaccine. The vaccine is not to be storage, it's to be used right away. We have built capability to do right now 40,000 vaccines a day is needed in our group to be able to try to do 1 million vaccine in a month if needed. It was a request from the mayor for us, and we did it right away in 3 places. We could do around 15,000 alone. And all the doctors are prepared in each practice. You should know that Somos Community Care, the doctors, already give 1 day free of their practices to go to anywhere, and we're doing that right now in those places, to work with the whole staff. Then our patients understand. The most important, I applaud when the vaccine were sent to the hospital to take care of the people in the hospital. But when they said, for example, to me, you need to bring your doctor to the hospital to get vaccinated, I said, you're crazy. Nobody wants to go to a hospital. My patient will not go there. There's an infection there going on. I don't want to go there, but we know that they will come to us, to the doctors. Then we were expecting to be the second one when I heard it was the urgent care centers. I spoke with the mayor about that. Why did that happen? When the urgent care center is called urgent, we are preventive medicine. And that's why the mayor and the governor, I see them working together, which is very good for the state of New York. And we, the people in the community, seeing this great team working now. We're able to put so many vaccines. And right now we are under serving because there's no vaccine. But I know that will be transient. Vaccine will show up. It's not about we don't have it. The important is it's coming and keep coming. The important is to see the positive side of this. I keep saying this vaccine of the hope is destroying the virus of the solitude because we have the vaccine, we're using it. And now secure the second dose is very important because otherwise it's a waste in what has been done already. And continue giving the other people the first dose. And our people out there who see us and the press continue helping in a positive way, informing the people, continue using the mask, wash your hand, social distance. If you go out, you haven't seen the disease. I said in August, July, that our community, Bronx, Manhattan, Queens, Brooklyn and Queens, already was so high, the blood test that we brought. We were the first one who brought the blood test, the IgG test, IgM, 40%, 45%. That when the second wave were coming, we were hit. But other places around the state will be hit harder because they haven't seen the virus. And that's why you're seeing now so many other counties so high, and so many people getting this illness and dying. But the future looks so good, and our people know that. And the press had this opportunity to tell them to have a hope, because certainly one way or the other, the vaccine, and we change the government now in Washington. I expect the unleash of more vaccine and some kind of strain thing coming to New York, who suffered the most from the beginning. And with working together, the mayor and the governor and the new president, I will see many vaccines come to New York. That I will see also other things very important. Medicaid deficits, things like that, will go away. And we will be able to do what New York was the #1 city in the whole world. You will see that happening again.
So, in some ways, the vaccine distribution process is going well, in that it's, it's now up, I think, 60,000 per day statewide. But on the other hand, we got these looming shortages in the city and in the state. At the same time, we got a new president. Maybe Dr. Varma could take a first crack at this one. What are the top issues affecting vaccine supplies to the city, and how would a new president, what could a new president do to alleviate them in the upcoming weeks?
Yeah, no, this is a question we're actually getting quite a lot of on our morning press conferences, and I'll both tell you what I know as well as I don't know. I'll start off with what I don't know. The process of making these vaccines is incredibly complicated. It's not nearly as simple as making like a Tylenol pill or something like that. I mean, you're talking about cells that manufacture DNA, turning DNA into RNA, packaging in these little lipid particles. There's probably thousands of steps along the supply chain. So I think one of the challenges that we need the federal government, through invoking the Defense Production Act, to basically get a window into all of those steps on the supply chain and to try to figure out what components of that supply chain could be addressed by other US-based businesses. And that is just something we have not had visibility into it because, quite frankly, the last administration sort of kind of left it up to the manufacturers to do all that. So we are optimistic that the new administration will, in invoking the Defense Production Act, get more visibility into the vaccine supply chain and be able to alleviate it. But again, that's a bet, right? We don't know that for an absolute fact. It's just our gut instinct. I would say the second thing that's going to be the real game changer are the other vaccines that are in clinical trials right now. There's 2 other vaccines that are enrolling right now that are fairly close to the point of getting approval, assuming that they're effective. So the Johnson & Johnson vaccine is probably the most promising one. And from what we understand, they should be finished collecting data very soon, like towards the end of this month, which means that if they show effectiveness, then we're looking at sometime maybe the end of February to have supply. And so that's going to be a huge game changer in terms of having a third vaccine, and also one that only requires a single dose. And the other is the AstraZeneca Oxford vaccine that's currently used in the UK, but really does require a clinical trial here because there were some challenges with the way they did theirs. So I think those are all the components. I think one, we need to get more visibility and understand through the Defense Production Act how the current vaccines can be sped up, and the other is the availability of new vaccines.
Yeah, and I would just say, Zach, just jumping off of what Jay said, from a legal perspective, it is the state that controls, who's getting what. And so, I think you heard the mayor today during his press conference talk about whether or not to use second doses that are left over for first doses. And I think Dr. Varma commented on that during the press conference. So, a lot of this is back in from a legal perspective, it's the state and then the city who sort of makes a determination on where these vaccines go.
If I could just add to that, I mean, that does sort of highlight one of the issues we face as a free society and as a decentralized society, right? We've got different decision makers at different levels. These guys all have to work within the state environment. The state itself has to work within a federal environment, and they all have competing priorities. I think there is a tendency or a hope that, as of yesterday, a button was pushed and things are going to be better. But there are structural things that I think everyone's going to have to contend with. It's not sort of an automatic fix. There's a light at the end of the tunnel, but the light is, we're not there yet. There's still a tunnel.
If I may say something regarding that, we have a conversation last week before my partner Henry Munoz with the president directly of the HHS, new Becerra and the vice president at the same time regarding that issue. And I know now somebody from the state is being named to be part of the task force for the vaccine in the White House. I believe the vaccines are going to be unleashed in a different direction. And New Yorkers, we have the privilege to start having vaccine like the other part of the country. But we were clear. Our people suffered the most was in the middle of the city of New York, with those neighborhoods where so many people died. The expectation is that we get vaccination, and we put in the hands of the doctors of the community to be able to give it to their patients based on the groups that have been created.
There's my mute. So equity has been a huge topic during vaccine distribution. But I've seen kind of something similar happening with distributing vaccines as we've seen with other efforts earlier in the pandemic, evolving scientific understandings or just new information. You know, the city or the state or federal government says one thing, you know, masks aren't effective for ordinary New Yorkers, or one dose means one dose. And then you hear new information about how maybe we can just use, maybe one dose of the vaccine is effective for people to some degree. Although that hasn't been the studies, we do see that idea being batted around. Maybe just second doses should be allocated for first doses. The question I want to get at is, you know, how do we keep the public updated to this evolving understanding of public health measures in a way that doesn't undermine their confidence? You know, I think with masks, this was a huge issue early on in March or April. It was said that people didn't need to wear them. And then once the spring came along, you know, we were hearing the exact opposite. How can we keep, how can the public understand how scientific understanding is always evolving?
If I could jump in on that, I mean, it is interesting, right? Because you do see that the public is hungry for information. I mean, you saw, you know, the ratings on the governor's daily press conferences at one point, you know, and people are looking for reliable sources of information. You do run into trouble, right, if you have multiple sources, only if they don't agree with each other, and that's where things become complicated. So in some ways, right, it's dependent on the people, for instance, participating in this panel, who every day are coordinating with other people like them in government, and, you know, aiming towards that level of uniformity. And I think it would be interesting to see how that works.
Oh, sorry. So, I mean, actually, that's actually a really good point with regard to our team. As I mentioned during the intro, I mean, as attorneys, you know, we normally are just speaking to our own client, you know, speaking to folks internally. And one of the things that we realized, you know, with all these new regulations coming out, and as our public health experts have been, you know, learning the new science behind everything, is really that it was so important for our team as lawyers actually to take this more public role of, you know, putting out frequently asked questions with regard to things like, you know, outdoor dining, with regard to the traveler restrictions. I'm sure that you've heard the mayor talk about this a lot too during his daily press conferences, but the city has been really focused on education because there is so much information out there, as Mark also, you know, said. And a couple of things that our team has done is, on our Twitter site, which is at NYC Mayor Counsel, or on our website, which is nyc.gov/counsel to the mayor, we do post not only frequently asked questions, but we also have been posting videos with, you know, short questions that we get from members of the public, which can sometimes include, you know, really just like an everyday person, but also elected officials. Sometimes you get questions from our sister agencies who are getting questions from members of the public. And we have been, you know, making attempts to translate them into other languages as well.
Yeah, we even have a podcast.
You know, there's something very important, if I might say, there's something very important there.
It's called City Hall Pass, if anybody.
It's about,
and again, it's about educating the public. Sorry, Dr. Ramon, I think you were talking. Sorry, I didn't mean to interrupt you.
no, I just want to say that this is why sometimes we did 3 polls in the middle of the pandemic, all different at the beginning, in the middle. We still did one last month. You have to see what the people think. Look into that, what the people down the ground, for example, who do they trust when you got to get information? That's very important. If you is somebody they don't trust, and it clearly, to me, you gotta tell you that politicians, elected officials, sometimes they don't clearly are the best to translate what's going on, what the truth is. You have to find people from the community. The voices that they go, is that the priest of the community, is that the pastor, is that the doctor, is that the nurse? And you use those people to communicate that to the public in order for them to understand. I'll give you one simple example, the virus. You know, every time I hear that, oh my God, they make an RNA, it's go to your cell, it's going to create some problem in your cell, because it's, you know what? The whole virus go to your cell and take over your cell and multiply inside your cell. Now just a vaccine is a particle, small particle of that, who will go there and do the same to create antibody without having the whole disease, because it's a piece of the virus. This kind of things in the hands of the right people should be able to help the people to understand all this sometimes misinformation about the reality.
I also think, Zach, that it's been really important, at least here in the city, that the mayor has routinely, during his press conferences, put our medical people front and center, like Dr. Varma, Dr. Choksi, Dr. Long. And I think, Jay, maybe you could speak to that, but I think it's been really important for the public to hear directly from you about what is happening. And, you know, oftentimes when we're putting stuff out, it's really in very close coordination with you, because it is the public health people that should be running the show. And I think our approach has been in stark contrast with what the Trump administration did. But Jay, I don't know if you had any thoughts on that.
Yeah, I mean, and this also just extends to the question I think that Zach originally asked, which is, you know, some major challenge with all of this is that we're trying to make incredibly high consequence decisions with imperfect information. And this just isn't the speed with which science can actually work. I mean, I often give people the example that, you know, we had a vaccine for polio that was developed in the 1950s. We are still learning to this day new information about how to use the polio vaccine and how immunity is. And people like want a decision like, why don't you know the answer right now about how many doses I need and whether this thing works or doesn't? That's just not, and some things are simply determined by time. People want to know, okay, how long am I protected? Well, unfortunately, the only way to know that is to let time to pass. And so it's a real challenge, I think, for science. And then how it intersects with the legal issues, as Kapil and Bess know, is when we're trying to defend ourselves, is oftentimes we have to use scientific judgment. And what is it that we think is the most likely explanation for something, and what is the most likely benefit? We get asked all the time. I can't tell you the number of times we get asked, well, exactly how many cases are due to being in a restaurant? You know, this is an infection that has an incubation period that lasts up to 14 days. Now, most people have an incubation period about 5 to 7 days. And what that means is that if I'm exposed today, sometime 5 to 7 days from now, I'm going to get infected. I'm going to develop symptoms. So then we go back and we interview that person. Okay, it takes them 1 or 2 days to get tested and they get their test results back. You're trying to ask me, what did I do in all of that period up until then? Well, I might have been to 3 different restaurants, and I might have gone to the gym. I might have gone to a religious ceremony. So there's uncertainty in everything that we do. And there is unfortunately sort of I mean, I don't want to be too detrimental about it, but some people have this sort of magical thinking that because we're scientists and doctors, we can be all knowing about human behavior. When in fact, a lot of what we have to do has to be based on inference, multiple lines of evidence that all point to a very logical scientific conclusion that may be disproved in the future, because that's the way science works. So when we change our mind on something, it's not because we were wrong, it's because we got new information, and that's how we change our opinion. So unfortunately, this is very challenging from a communications perspective and from a legal perspective, and obviously from people who have to, you know, have decisions imposed on them when they don't, you know, obviously have to get the opportunity to be exposed to all that information and decision making.
So, you know, two of the biggest variables to finally ending the pandemic once and for all, as we've all anticipated with vaccines, is these new variants, especially the one from the UK and South Africa, and whether a vaccine actually prevents people from transmitting the virus. We really don't know. We know that they're about 95% effective, the Moderna and the Pfizer ones at least. But you know, we can't even ask vaccinated people who have gone their 2 shots to you know, they can't resume their normal life until we really know more. You know, what do we do about these two? You know, the variants and these outstanding unknowns about the vaccines moving forward?
I would say the same thing. Time. He was right. It's time. Our main things before was about mask, no mask, stay home, distant. Things evolve. Will evolve because we are learning over the period of time, and we cannot run faster than the ball. There's no question about it. It's been known and known. I'll give you one example. When you put together what was the thought at the beginning of this pandemic and what is today, how advanced we are today, thank God. We are working with the vaccine. It is, we know, because we've been doing, I asked to my task force, the government task force, why are we want to give the vaccine to the people who already had the disease? And we know that they have antibody. We shouldn't give it to them. Let's give to the people who are still negative, who hasn't seen the virus. We start working with those ones. Therefore, we continue checking in the other one, the antibody, because what are we looking when we put the vaccine? We're looking the body to create antibody. If somebody already have it, why should we give it to them? Let's use that one with the one that's still negative. It didn't work like that. Everybody's getting it. As a matter of fact, the first patient who was done in Long Island was somebody who was already had the disease and still had antibody. But it's still what it is. We're learning over, it's a curve. And nobody knew. One more time, nobody knew. This is a learning to be keep it in the book forever for humanity, with the way of communication that we have today, to be sure that the future doesn't repeat itself. And that inequality that exists in our communities, our neighborhoods, doesn't repeat again, that we should be more prepared to help those people who are essential workers, who get right away infected and they have to continue working.
In fact, speaking of the new variant, I recently, the mayor called on the federal government to stop flights from the UK because of the new variant. And, one thing that the city has done and is continuing to do is to implement the state's travel quarantine restrictions. And, there's a lot of information, online, so I'm just going to touch on this briefly. But basically, anyone who spent more than 24 hours in another state or in a CDC level 2 country and is coming to New York is required to complete something called the New York State Traveler Health Form and quarantine for 10 days. But if, they're asymptomatic, they still have to monitor their symptoms for up to 14 days. There are some exceptions to this restriction. So this doesn't apply if you are coming from one of our neighboring states, New Jersey, Connecticut, Pennsylvania, Massachusetts, or Vermont. And there is also an opportunity for you to test out if you kind of prepare ahead of time. So if you are coming from, let's say, Maryland, you can take a COVID test 3 days or fewer before you arrive in New York, and take a second COVID test on your 4th day of quarantine in New York. And if those tests are both negative, then you essentially test out of quarantine. So I do think, and I'm sure the doctors can both speak to this, more from a public health perspective, but the things that we are currently doing are things that we need to continue to do regardless of whether or not you've been vaccinated, in order to ensure that, the public remains as safe and healthy as possible.
Yeah, and that's why we continue to have our traveler checkpoints and various mechanisms in place in order to ensure the public health. And again, Dr. Varma has been closely involved in all of these things. And I think, just to touch briefly, I think one of the great, I don't know if it's a surprise, but it's a fact. Once New Yorkers have an understanding of these rules and regulations, and I think, Dr. Ramon, Mark, and Zach, you all touched on the complex milieu of laws and regulations that come down from the state and the city. I think once people have an understanding of what those rules of the road are, we've seen tremendous compliance. And I think that goes to the fact that most New Yorkers, almost all New Yorkers, feel they're willing to take and make whatever sacrifices necessary to keep their fellow New Yorkers safe. One of the things that we have, if you look, when you drive into New York City, the state posts, they have all these digital billboards, and they have a web address, which is nyc.gov/travel. That takes you to a FAQ that actually Dr. Varma and us worked on, that really sets out all the regulations that Bess said. And I think it's just important to keep providing simple, digestible information to our fellow New Yorkers so that they do understand what the rules of the road are.
So I want to make sure we get in a couple audience questions before we run out of time. One of them that came up concerns vaccine distribution. Some of you have probably seen the new numbers that show that the percentage of healthcare workers in the state, both inside New York City and outside, is falling short of the 75, 85% of immunity level that's needed for herd immunity. So one anonymous attendee asks for our panelists to just comment on the reluctance of healthcare workers to get a vaccine. If we can't get 85% of them to get vaccinated, what hope is there to get herd immunity in the population at large?
Yeah, I mean, this is Jay, I can answer. So again, I want to try to get people to understand a little bit about, that's why I went through the process of all the different layers of defense that we have. So this gets complicated because yes, in the ideal world, we have a vaccine that everybody is eligible to receive. Right now, we only have a vaccine that's approved for people 16 and above. So already you have a certain segment of the population, anywhere from 1 to 1.5 million people at least, who are not eligible to receive the vaccine. So that's one challenge. The second is you have to work on vaccine acceptance. And that is not something that happens again overnight. You don't just snap your fingers and then people accept vaccines. It takes us years from the introduction of a vaccine to get high levels of uptake. And we know that from the most recent introductions of rotavirus vaccine, of chickenpox vaccine, of HPV vaccine, a whole number of different ones. So there's a bit of an unrealistic assumption that somehow that, within the next few months, even if we had an unlimited vaccine supply, that everybody would agree and want to take it. We want that, we aspire to that, but we also have to be realistic about what's actually going to happen. So what we do expect and should ultimately happen is that we get to a point where we can start to peel away layers of those defenses that I described. I talked about the 3 different things: individual measures, testing and contact tracing, and business restrictions and community restrictions. The most odious of those are the community and business restrictions, right? I mean, those are the things that really strangle you. So if we get to a point where we have enough people vaccinated that in combination with individual measures and testing and tracing, we may not be, again, back to totally normal, but we may be at a stage where business activity and other things continue on. So that to me is actually the more realistic short-term target. And the longer term target, of course, is get to a level where we have a vaccine that, one, everybody's eligible to take, and number 2, we have high levels of acceptance. So I just wanted to reframe it a little bit by saying that the immediate near-term target is not to get to population level immunity. That is the dream, but we have to be more realistic about what we can actually get to.
And it may be an open question too, if they don't get there, if we don't get there, what does government do at that point, and what can they do? They're theoretically, right, some kind of mandatory vaccination is a possibility, certainly on the table. In practice, I think historically, there has been hesitation to do like truly mandatory and not, give individuals a way to opt out. We saw this in connection with mandatory influenza vaccination in facilities a few years back, where there was an opt-out if you're willing to wear a mask. Even, the case that laid out states, police powers to compel vaccination still allowed, you to pay a fine and not get vaccinated. So it would be interesting to see if we got there, but I think it makes a lot of sense to not shoot for 100%, just like Dr. Varma was saying.
There has been proposals at the state level to mandate COVID-19 vaccinations in the future. What would be the city's possible role in future vaccine mandates like that?
Kapil, do you guys want to answer? Or do you want me to talk a little bit? I'll just say broadly speaking. So just let me talk in general about vaccine policy. We know that one of the strongest ways, and you can look at this at the county level across the United States, and you can look at it globally across the world. One of the strongest ways that you get high levels of vaccine uptake is having mandates for specific activities, such as public school entry. That far and away is the single biggest determinant. After that, you get into things like a strong recommendation from a healthcare provider, other things like that. So there is a world in which, and then related to that, we have influenza vaccine, which the state currently mandates for anybody working in a healthcare facility. But there's an exemption. If you choose not to get influenza vaccination, you have to wear a respirator, and oftentimes you even have an ID badge that labels you as not being vaccinated. So again, we're not at that point yet because we don't have enough vaccines. We don't have enough experience with them. There's not enough supply. But these are all the types of things that I think need to be discussed and debated. And to get to Mark's point too, there has to be a realistic and very practical discussion about what happens when we get to the point where the supply of vaccine vastly exceeds the demand, but you still aren't at a population level of immunity. There isn't any other disease for which we close and restrict businesses, when people don't accept it. We just try to push vaccination. So these are the types of discussions and debates that need to occur among public health people. They need to occur among regulatory people. And we need to be considering it once we get, because we're going to be in that world soon. It may be 4, 5, 6 months from now, but that's going to come out pretty fast.
Yeah, and those are exactly the questions that a court's going to ask if and when these type of restrictions are imposed. So I think, as Jay said, a lot of these things have been done as it pertains to the flu vaccine, and we have a little bit of precedent, but there are a lot of things or a lot of restrictions that we can impose vis-a-vis the COVID vaccine that haven't been imposed thus far. And we really don't have answers from courts in terms of how far they're going to allow those mandates to stand.
And, just one last thing that I wanted to ask all the panelists before we wrap up was, again, just getting back to equity. We've seen so many different ways how the pandemic has emphasized the racial and economic divisions among New Yorkers. Just could you offer, what is a lesson learned from earlier in the pandemic about fostering public confidence in public health experts that, whether it's from masking or anything else that can be applied to the vaccination distribution effort moving forward?
I can jump in on that. I think one thing we learned, right? Up until the pandemic, the focus was very much on coverage, right? The thought was if people can get their health care covered, they will get that health care and everything will be better. To some extent, that is true. But the one thing that I think was highlighted is it's not just about who pays for health care. It's also about actual access to health care and whether you can get the care you need. And there's a number of factors involved too, right? There was that notion of essential employees. And I think you saw, that overlapping with racial and ethnic minorities in a way that was damaging. But it is, it's as with so many things, what the pandemic did was highlighted facts and trends that were already there, and in some ways accelerated, I think. But I'll defer to the experts on that.
But let me talk about a little bit about inequality, because it's so deeply and what happened in our community that we serve, where we have close to 1 million Medicaid lives. I want to say something very important. Sometimes people say, don't repeat it, but I must say, because it's the truth. At some point, one of the big authorities in healthcare from the federal government said this: we need to start making sports, but the sport people have to be separate, not public, and they have to put in rooms in hotels, separate each one, and be tested every 3 days. And I said, did I hear right? I'm being screaming to get isolation here. At the beginning of this pandemic was 70% positivity rate, and track and tracing doesn't show up. And these men want to put the sport people in rooms, separate every 3 days, test every 3 days. Why? Then I said, yes, it's right. This is why. First, for me, it was so difficult, and for the state, for the city, to find one stick to do testing and the reagent to put in the machine, 8800 Roche in New York, one of the largest machines that we could use. And then he wanted to do the sport people, elite, a test every 3 days. On top of that, I say, why? You know why? Because the people of my community are the one who move the elevator, drive the car, serve the food. That's a very elite way to think. The inequality in that mind is clear that we are here in the floor and they're on the top. When you say that thing had to change in the country. We are equal under this law. We all pay taxes. We all work. We are essential too. How can you say those kind of things in the TV when so many people in my community are suffering in a small apartment, 12 people with one bathroom, one bedroom, to sleep, and somebody get infected, 2 dies, who knows what happened. This is the kind of thing that I see the sensitivity had changed. People understanding that this cannot continue in the country.
Well, that's a pretty good note to start to wrap things up on. We're running out of time, but I was hoping each of our panelists could offer one little nugget of wisdom, one takeaway for our audience to wrap things up. We'll start with our resident Somos healthcare expert, Dr. Ramon Tallaj. What's one takeaway for everyone?
Well, the takeaway is we have to be patient. We didn't ask for this virus. It's happening. We are humans. This kind of situation is not the last time it will happen. We need to be prepared for the future. But right now, we need to be sure that the people who suffer the most get protected, get treated. They have no money. You know, there was a time that they got almost 70% lost their health care. They had no job. You know, we have to work together as it's happening now. I believe this together, somebody who could bring people, because this is the kind of approach that we need to do. You mentioned a new mutation could happen. You know what? It could happen, but nothing we could do about it. You know, we have to work with that, stick together and find a way, use all our resources and unify, looking for solutions that will bring the help that we need in our communities. That's what makes us in our part. We will continue doing the same as fast as we can. Put the money and the release and the staff and the human bodies to work whatever is needed to do testing, to feed the people, to vaccinate the people. That's what we do, and we are ready to continue doing that, helping the mayor and the governor and even the president, whatever way they need it in the country.
Be patient. Takeaway from Dr. Tallaj. Dr. Varma, what's one from you?
Yeah, so I guess two things. First of all, two things. One, Zach, I saw there's lots of questions in the Q&A, so we'd be happy to, I think, probably to come back at some point and help try to answer some of them, because we really do feel like that information that people have is so important to all of this, given all the uncertainty. And I would just say the only second one, sort of, you know, echoing off what Dr. You know, sort of riffing off sort of what Dr. Tallaj said about patience. The other is really persistence, right? I mean, we are all personally exhausted. You know, my wife, my kids, all of us, we would love to get back to life the way it should be. But we also know that it does take time to get through something this difficult. And so we really want to emphasize to people just the importance of doubling down on the measures that we know are effective. And also, you know, the information and the science, and my wife is a pediatrician. She's already been vaccinated. I will get my vaccine when it comes in turn. So really trying to spread the message that we actually have power with us. We have the power of individual measures, and we also have the power when vaccines become available to get those. And we really want to encourage people to continue to adopt those, because there is a time when things are going to get better, but it's going to require patience, and it is require more persistence.
Excellent. Kapil, what's one nugget of wisdom to close things out?
Yeah, I would just say, Zach, I think one of the themes that keeps running through my mind over the last 10 months has been evolution and the ability of New Yorkers to evolve with this virus. I mean, their innate strength look, I won't say I'm surprised, because I love this city and I think it's the best city in the country. I think our people are extremely educated. They have a lot of inner strength, but this has been a long slog. And I'll tell you, even for our office, you know, look, we're lawyers, and, you know, we have a couple doctors on here. When you're in medical school, you're taught to deal with life and death on a fairly regular basis. That's not on the curriculum in law school. And the questions that we've had to deal with on a regular basis, from the day this started in late February to today, every single one of those questions involve life and death. And they involve people's ability to economically survive. You know, does this business need to close? How many people can be in there at one time? You know, a lot of questions about funeral homes when we were dealing with shortages there. I mean, these are exceptionally difficult questions to answer legally, but psychologically as well. And I think, just like everybody in New York City, I really give a tip of the cap to the 350,000 city workers who have worked night and day. I know I have 15 of them who work for me who haven't taken a weekend off since February and are literally on 24/7 because the virus doesn't sleep. And we're not going to sleep either. And it's a great privilege, I'll say, Zach, and I know I speak on behalf of Jay and Bess, and I'm, Dr. Ramon, Mark. I think any of us who have the opportunity to serve the public, it is such a privilege. A lot of people got up in the morning during this pandemic and said, what can we do? We knew what we could do every day, and we understand what a great privilege that is. So a real tip of the cap to the city, our fellow New Yorkers, and to all the public servants who have worked night and day to keep our citizens safe.
And you, Bess, quick thoughts?
Really, I want to kind of reiterate things that have been said already, but New Yorkers, I'm from New York, I grew up here. New Yorkers have really shown a resilience and a real sense of compassion and care for each other. We have gone from not being a society that wears masks to putting them on. Mine is right here, to putting them on as soon as you get out the door. Really looking out for each other. And I want to thank everyone on this panel, but everyone who's listening, all New Yorkers, for doing what they can to take care of each other. Just to kind of reiterate, an earlier point, I really want to encourage that when everyone is eligible, when you become eligible to get the vaccine, to go and get it. I just think, New Yorkers have done such a great job taking care of each other. And that is one thing we can do when we become eligible. So thank you all so much for everything.
And we're going to give the final word to Mark.
And I will also end on a positive note. Even in a terrible tragedy like this, it has given us the opportunity, I think, to reevaluate how we do things in the public health space. And it has created some tremendous opportunities. If you look at things like the expansion of the use of telehealth, if you look at things like increased cooperation among providers in a way that they've never cooperated before, even just the recognition of the importance of public health in decision making, even outside of the public health context. All of that is good, and all of that is going to improve our ability to respond to things like this in the future, and improve, I think, the efficiency of our healthcare system. So even here, good things can happen.
I need one word before we close, and it's for me, for my people. Pray to the Lord.
Well, as we hear, there is hope at the end of a very deadly pandemic. I'd like to thank all of our great panelists for taking part in this discussion. We can certainly keep the conversation going. Subscribe to my newsletter, comes out every day at 2 p.m. First Read Coronavirus Update, sometimes starring Dr. J. Varma with occasional cameo quotes. And we will also have the next installment of our First Read Coronavirus Health Update on February 23rd. Registration is free and can be found in the chat. And we also have our Over 50 Over 50, the Age Disruptors webinar on Tuesday, January 26th. And our Rank Choice Voting webinar is on January 28th at 2 p.m. So thanks again for everybody. You've been a great audience. Thank you very much to the panelists. I'm going to give everyone a nice round of applause to close things out. Catch you next time.